We talked today with Mahoning County's medical director, Dr. James Kravick, who said that COVID and the flu have some overlapping symptoms but can affect people differently. First News reporter Lindsay Watson tells us how to deal with COVID and the flu at the same time. Her story is new at 11.
Based on symptoms alone, it may be hard to tell the difference between COVID-19 and the flu.
So what we've seen, as we have patients come in the medical practices and in the emergency rooms and in the hospital, they're very, very similar symptoms and hard to tell.
Over FaceTime, Dr. Jim Kravick explained how COVID and the flu are both contagious respiratory illnesses, meaning they affect your lungs and breathing and can be spread to others. The two illnesses are caused by very different viruses.
We continue to see more cases of coronavirus in our county and in our hospitals. We haven't seen a big uptick in flu yet, but we are preparing for an increased number of flu admissions as well.
The Centers for Disease Control and Prevention estimates that 22,000 people in the U.S. died from the flu during last year's flu season. Just this week, the U.S. surpassed 210,000 deaths from COVID-19.
The challenging part of the statistics is knowing the total number of people that are infected with really influenza or COVID. Because if someone's not tested, they're not in the bottom number to know the correct percentage then of the mortality rate.
Dr. Kravick says what we're doing to help stop the spread of the coronavirus is making an impact.
With the masks, social distancing, covering our coughs, staying home when we're sick, will reduce the spread of influenza as well.
But he says it doesn't replace the need and importance of getting a flu vaccine.
It's the right thing to do to save lives from influenza. It won't affect coronavirus per se, but it will reduce death from influenza.
Lindsay Watson, WKBN 27 First News.